we're really excited today to have Ken Liss, who is with the Brookline Historical Society, here with us to talk about the Spanish flu and how Brookline dealt with it then. I am your host today, Kathy Bisbee, the Executive Director of Brookline Interactive. And I have to say, Ken, this is a very welcome shift for us to be able to do some historical content when we've been very much in the thick of providing the schools in the town with emergency communication services. So thank you so much for taking your Sunday afternoon and joining me on this program.
I've been spending a lot of my weekends on historical things during the week in my full-time job at Boston University. I'm doing a lot of work leading the library's support for faculty who are teaching. So I'm always welcome the weekends now where I get to spend time doing the historical research and sharing of historical research that I love to do.
Well, I have to tell you on that note, I've been realizing that this gives me a little bit of time on the weekends, at least, to go through boxes and boxes in my spare bedroom that have all of my historical content in them. I'm sort of an amateur historian. And
me too, by the way.
You too as well. And I'm from a small town of 400 people in Western Maine, and so I grew up with a very strong sense of history. And my great aunt sort of instilled in me a lot about looking for the family roots, and so I've been an amateur genealogist for 2 decades now. And everyone calls me when they have kids projects, hey, can you tell us about our roots? And of course, we've been working on this immigration storytelling project, which you may know about, called Arrival VR. And the idea really has been to start in Brookline by documenting stories. The Community Foundation gave us a small grant to record stories. Andy Fisher was one of those folks who has a great story about coming from Eastern Europe to Brookline. And we think that it's really important to tell those stories because we're all part of that story. We all have a story to tell about how our family arrived here, how our families originated here, or migrated to this country. So on that note, let's jump right in and talk about the Spanish flu. And it didn't really originate in Spain, why is that?
I was going to say that, and it's really called the Spanish flu mainly because when it erupted during World War I, Spain was not in the war and had much less censorship. So news was coming out of Spain much more readily than most of the other European countries. And that's really why it was called the Spanish flu. But it's really a misnomer. And it's kind of interesting, as with so much parallels between the 1918-19 pandemic and today, we have the president and others calling it the Chinese virus, and that's not what it is and not what it should be called. And it's been interesting to see that today, as people talk about the 1918 pandemic, they do call it the Spanish flu, but it really wasn't the Spanish flu at all.
So, and that's because the other media during that time in other countries didn't exist in a way, right? That Spain was the only one that was really having reporting because of World War I. Is that correct?
Yeah, well, I wouldn't say it didn't exist, but it was much more constrained, and information was controlled and didn't get out as easily, and perhaps some of the countries kind of didn't want news about the flu coming out from their countries.
Interesting. So how did it first arrive in Boston?
Well, it first erupted in Boston, in Boston Harbor, among merchants, sailors on ships, and that was in September of 1918. It was one of the major places in the world where it actually broke out first.
And what was the first case in Brookline? Do we know?
Well, I don't know if we know the first case, but it was actually the outbreak among the sailors was really where Brookline first got involved. A doctor whose name was William Brooks was a Brookline doctor who had a hospital up on Quarry Hill. The building still exists. And he was also the Surgeon General of the Massachusetts State Guard. So he was called in to deal with the sailors who had become sick on the ships. And one of the things that he noticed was that they were on the ships, they were in very poorly ventilated conditions. And he arranged to set up a open air hospital on Quarry Hill, more or less where Quarry Hill Park is today. And with the help of the Massachusetts, the Brookline company of the State Guard and the town engineer, Henry Varney, and other local officials, literally overnight, they set up this tent hospital up on Quarry Hill. They put in sewage connections and water connections and lights, and they cared for the sailors who had become sick and were brought there from the harbor. So it wasn't actually treating people from Brookline. It was, in fact, the State Guard patrolled so that people did not come to this outdoor hospital. It was only for the people who were sick and the people who were attending to them. So that's where it really first came about, and they were pretty successful. Some of the patients who came there did die, and some of the medical workers did get sick, but they may have contracted it before the hospital opened. But their rate was better than elsewhere, and the methods that they came up with were used in other places as well.
So it's interesting because I'm thinking about that time period. I mean, 1918, where were people at in terms of how they saw the things like viruses? I know in the latter part of the previous century, they didn't really believe that germs existed. So
Yeah,
where were they at in 1918? Give us a sense of that,
I'm not sure
if
I
you know.
can. I don't know much about what people's attitudes were then. I do know that when the flu started to come in Brookline, and particularly when it started to be seen among the general population outside this hospital in Quarry Hill, that the attitude, at least as reflected in the local newspaper, initially was don't worry so much. We'll see. Um, and very similar to what's happened here. The similarities are remarkable in so many ways. But one of the first things that was said, I'm just going to look at the blog post I wrote about this back in 2009, so 11 years ago.
Wow.
Uh, an early editorial in September 14th from the Brookline Chronicle said, for the individual, his or her course of action is simple. Until it is evident that the epidemic has been checked or has run its course, it would be well to avoid crowds, to keep outdoors as much as possible, sleep with windows open, eat sanely, and in general lay in just as large a stock of health as possible. So they were cautious, but not overly concerned. And over time, as more people got sick, the tone changed. So a week later, as it became evident that the disease spread fairly easy from person to person, the same newspaper wrote whether the schools are kept open or are closed, whether or not the doors of moving picture houses and other places of assembly are shut, there will still be open other avenues of infection. We are in a state of siege and might as well accept it. So things became quickly more serious and taken more seriously, and the reaction of the town. Another thing that's just been remarkable to me as I see what's happening today and reread what I wrote 11 years ago is that it was dealt with in largely the same way. So the schools were closed for a month.
Wow.
Public gatherings were limited. They didn't close the stores, but they forbid gatherings in movie theaters. Brookline didn't have a movie theater at the time, but neighboring communities did that. The town pool and the gymnasium were closed. Billiard halls, bowling alleys, churches. Meetings were forbidden. Even funerals, except with express permission, were forbidden. So they really tried to limit people's contact with one another. Some people were quarantined. When somebody had the flu, they would mark the door so people knew. Um, and similarly, people kind of came together in ways of trying to help one another.
How did they mark the doors? I'm so interested in that. What did they? It sounds like a scarlet letter on the door.
Yeah, Scarlet Letter, or as we're getting close to Passover, I think of the, the doors of the Jews that were marked in ancient Egypt. But I believe they put I believe it was a piece of paper, where they said, let's see what it was. They put some kind of a mark on households. A red card. Okay, so the health department, assisted by other municipal officials, placed a red card in the front and rear of every house containing persons suffering from the disease. In addition, a white card has been placed on the door of each sick room, which prevents all but doctors and attendants from entering.
Wow. So they had a good system to let people know who, I mean, that's one of the challenges I think we're faced with now is we don't really know who has it or who, until people are symptomatic. We don't
Right,
know. We don't know. So
right.
it's at least at that point they had a way of telling. So with the Spanish flu, was it really obvious that people had the Spanish flu? And I mean, the symptoms were similar to, I mean, they're influenza, right? So I mean, they would
Yeah,
be pretty obvious, I think.
I think so. I'm not sure, and I'm sure you and me and everybody is at least several times a day. If we you know feel a little warm, I got hot under the collar at work the other day and took my temperature. um, but it's allergy season, and I've been
Oh my goodness, I know.
coughing and sneezing, and every time I do, I worry about it. But I think. Maybe because the flu was something that had happened before, and maybe people were more familiar with what the symptoms were, and
Yep.
had a better sense, as opposed to a virus like this, which is something we haven't dealt with, so we don't really know how to diagnose it ourselves quite
Right.
easily.
Right. So, back then, at first, it seemed like the town was pretty confident that it could contain the disease. And I'm looking at a quote from the Chronicle that you just mentioned, and and then Camp Brooks was set up, which you've talked about. Why wasn't it an open air hospital? Was that just because the thinking at the time was it could fresh air would help folks, or was there some other reason for that?
Yeah,
There was no other
I think
available space?
I think that was the idea, and partly driven by the fact that the sailors who originally were infected were in such cramped, poorly ventilated areas. And I did, at the time I wrote this, I was in touch with some scholars in England who wrote some about it, and it
Hmm,
seemed, as I recall, it's not definitive that was a factor, but certainly uh, being in less cramped quarters and open meant less possibility of infection. The sunlight was thought to help, and I'm not sure if that's proven or not. Um, but those are some of the reasons.
maybe it was the vitamin D, because I think we did know that sunlight could help your immune system overall at that time.
Yeah, yeah, and
So,
I know there was a Brookline architect who was the son of a prominent Brookline resident who actually did a lot of work about the effect of sunlight and designing
oh,
hospitals with more sunlight.
oh, that's really interesting. So there was a ban on public gatherings at some point. When did that happen during the Spanish flu epidemic?
That happened. Let's see. So the schools were closed on the 14th of September and on the 24th, so 10 days later, with the number of deaths rising. Oh, I'm sorry, that's when the schools were closed, and that's when the public gatherings were closed. I don't know that they did the kind of thing that we're seeing here, where saying that no gatherings larger than a certain number. But they said no gatherings at certain places where people would normally gather. They did not,
Right.
as far as I know, close businesses, But in the blog post, I did find the ways that some of the businesses took part. And one of the ones that was interesting, the Young and Brown drugstore in Brookline Village noted that we only use sanitary paper cups. So they weren't using glass cups. So
Oh,
again, similar to today, where Starbucks, when they were open, and others were saying, don't bring your own cups. We're only
yeah.
using the cups that we provide. So
Yep.
it really is 100 years later remarkable how similar the response and the way of dealing with it is.
Now, how many deaths were there at Camp Brooks, and then at what point did we start seeing those deaths in the Brookline community amongst residents?
In Camp Brooks, I believe it was. I'm just going to find that uh, there were 351 patients treated, and 35 died. So 10%, which according to William Brooks, the doctor, was a much lower rate than in indoor hospitals, despite the
Mm,
fact that this hospital took in some of the worst cases. Um, uh, in Brookline as a whole, it was estimated there were 125 deaths. It's a little hard
wow.
to know what the count is, because some of the people who died in Brookline were not from Brookline. There were Brookline people who died in other places, so the count is a little hard to know. The first person to die from the disease in Brookline was a police officer named George T. Driscoll, who died on September
Oh, no
10th.
kidding. Huh.
He'd been sick for 2 weeks, but his illness had not been reported as influenza at first.
Mm, interesting. Also, some similarities. People not knowing if they had it or not,
Right.
and then it getting quickly exacerbated towards the end.
Right.
How long
Also,
did? Go ahead. Sorry.
also interesting that it was a police officer, because
Yep.
we know that some of the Brookline firefighters have been infected, and
Yep.
we know the people who are doing important jobs, essential jobs, and helping the rest of us are themselves in more danger, and that's something that was apparently happening back then as well.
Absolutely. So, was there a point where the economy also was really impacted by this in terms of closures and that sort of thing?
I haven't seen anything about that. Certainly, haven't seen anything about that in Brookline. I don't know more widely if that was the case. I don't think uh, there weren't the kind of shutdowns that we're having now. So businesses were not closed. Places that those large gatherings were closed, but at no point in Brookline, I'm not sure about other places, there was no order to close businesses. Um, so people businesses were still
We're still
operating there.
operating.
Yeah, and there was one of the things that I found most touching in a lot of ways was another editorial in the Brookline Chronicle that said, that urged residents to be patient. That said, if telephone service is poorer, if the streetcars run less often, if only one clerk is behind the counter when there should be two or three, if any of the ordinary daily services that we look for as a matter of course are less well performed than usual, remember
Mm,
the numbers on the sick list and have patience for those remaining who are doing double duty. So again, it indicates that places were open, but that also people were being asked to, and I think generally were understanding that things were not normal, and that we had to adjust our expectations and be nice to one another. So
well, I hope we all hear that message now too, because it's not normal for anyone, and everyone's doing the best they can, and we have to kind of roll with the punches, as it were. How did the community help each other during this? Were there stories about ways that folks supported each other and helped others who
yeah,
maybe
yeah, there
had less
were.
resources?
There were, and there was a lot of effort done by an organization called the Brookline Friendly Society, which is a wonderful name, which was a charitable organization. It is now, its name changed years later. It's now the Brookline Community Foundation, but it's the same organization with the continuity. And they opened a soup kitchen where they had volunteers who cooked broth in their headquarters in a building that's no longer standing at the corner of Walnut Street and High Street. And other volunteers collected, and I'm reading from the report, custards, jellies, fresh eggs, and other dainties made by people in their own homes. And these, along with broth and milk, were distributed to needy families every afternoon. 49 automobiles were made available to the Friendly Society by local residents to help with distribution.
Wow, that's a lot of
Yeah,
automobiles for that time period,
it is.
actually.
It
Saying
is.
1918, would we had Model A's and Model T's at that point? I
We
wonder if
had
we
a
had
lot.
anything else more.
We
There's
had
more
a lot
probably.
of there were a lot more models of cars in those days than there were today. And some of the town reports will list all the automobiles. I'm not sure they were still listing them in 1918, but earlier in the century they would list every automobile that was owned and what brand and model it was. And there are lots of them that I had never heard of before. So it was really quite fascinating.
My cousin has a 1929 Minerva,
Ah,
which I'd never heard of, and I think there's 12 of them in the whole country. And he actually he created the machines to machine his own parts
wow.
for the Minerva. But I had never heard of that, and really only kind of knew of Model A's and Model T's, and the truck version of that. But to think that there were 40 cars, that there probably were many more at that point in Brookline,
Yeah,
even.
and of course
Wow.
it was largely a fairly wealthy town, so there were probably more
Right.
cars per population than most. But that also brings up another aspect that, again, has similarities to today. So while Brookline was a wealthy town, in fact, it was often referred to as the wealthiest town in the country or the wealthiest town in the world. I don't know that there's any data that you can really say that, but it was a wealthy town. But not everybody in town was wealthy. There were immigrant populations in
Yep.
certain parts of town, and in general, I think that they were more at risk because they lived in more crowded conditions. They probably were not as healthy because their nutrition wasn't as good. So there were questions of equity and ability to get help and to be safe among different populations in the town, which again is true again today.
So that soup kitchen was really used. That the community foundation, did the community foundation come out of that effort, or they were around prior to
Yeah, they were
Spanish
around
flu?
prior. They'd been around. I forget when they were founded, but they were around before that.
Yeah, I want to say maybe even 100 years prior. They were maybe not quite that much, but they were around
Probably
for
not.
quite a
Probably
while.
my guess. I shouldn't guess, but is that they probably emerged in the late 19th century or early 20th
Okay.
century, when there were a lot of immigrant communities and a lot of movements, often led by upper classes, to like the settlement movement that worked with charitable efforts to support those who are well off in society.
Yep. So, I'm reading some of these quotes that our wonderful intern Kristen put together for this purpose. She said the Chronicle wrote, "Such an epidemic as this tests our social institutions, shakes our confidence in their sufficiency, it tries out our organizations to the protection of the public." So, were there a lot of discussions in the Chronicle and amongst the townspeople about kind of the best ways to do this, and the fear of uncertainty? What do we know from that history?
That's a good question, and I'm not entirely sure. I mean, I have a lot of quotes from when I did this research, which was 11 years ago, and of course my access to the Chronicle is through the microfilm on the library, which so I'm not doing any additional research. But I think there was a lot of discussion, and there's another quote from the Chronicle that actually is a continuation of the part that I think you just read, that that I thought was really interesting too. It said, um, So such an epidemic as this, again, this might be just what you just read, but I'll continue past it. Such an epidemic as this tests our social institution, shakes our confidence in their sufficiency. It tries our organizations for the protection of public health, raises questions as to whether the work of doctor and nurse might not be as much of a public concern as that of soldier and fireman, and whether they ought not to be, frankly, in public rather than quasi-private service. And it also raises, or should raise, a question or two about public living conditions and housing. So I think they were really looking at healthcare as a not a private thing. I mean, it's like healthcare for all. They were talking about that in a way in 1918, and also talking about public living conditioning and housing. So these are issues that have not gone away, that are big issues in our lives today and in our society, even without the virus, but that have an impact on what happens to people when a crisis like this occurs. So that was being talked about 100 years ago, and that's pretty amazing.
Yeah, I mean, it kind of begs the question around, what have we learned from history? Have we learned? And also this question of um, how we are interdependent on one another. And I think things like the Spanish flu and this epidemic, the COVID epidemic, is making a lot of folks ask the question of, we can't, you can't protect yourself because we're all affected. And even if you have resources and money, you still really, we're all in this together. And so I wonder what we learned from the Spanish flu that maybe changed the fabric of the community of Brookline,
Yeah,
if
I don't know.
anything.
I mean, I think the lessons learned were probably more than local, because this was happening everywhere, and has affected the way society, groups in society, individuals in society think about these issues over time. Um, I think the the both for the good and the bad. I mean, one of the ads that I have in the blog post, while there are other, like, we have the ones about only using paper cups, but we also have one that says stop the influenza, keep warm, and at the same time save coal by using our oil and gas stoves. So we had a local uh, uh, company on Washington Street in Brookline Village that was, trying to boost the sales of their products, and we're seeing some of that today. So I think both the coming together that happened then is happening now. We're certainly seeing some of the negative taking advantage, and I'm sure there were people who ignored the warnings back then. So uh, obviously we know a lot more than we did then, but we're dealing with a virus that we don't know as much about, and that uncertainty causes a lot. Um, so I don't know. It's a really good question of how much we learned. Not so much what we learned medically and the professionals, but what we've learned as a society. Um, I'm sure there's going to be a lot of writing about this moving forward. I know that one of the classes at BU that I've worked with for a number of years, taught by a close colleague of mine who's also a Brookline resident. It's a first year writing course, and the theme of the course is representing illness. And
Wow.
uh, uh, she's not teaching this semester, but we've talked a lot. We talked yesterday, and I know when she's back to teaching that course, it's going to provide a lot of material. So not just for the experts and the scholars, but for students who are always interested in researching and understanding things that have impact and meaning in their lives and that are topical. And this is going to be something of great interest. I know that as an amateur historian, and I do call myself an amateur historian because I do not have a degree in history. I don't have any professional training in history. Um, I'm a public historian, which is a term that's often used. But I do know that while, like everyone else, I'm nervous, I'm worried, I'm
Mm,
scared at various
yeah.
times. I'm also fascinated because this is we are living history, and it's always something that when I read about things in the past, I wonder what was it like to live through this, and this is probably the most momentous event of my lifetime, and I'm 65 years old. Certainly, there are people who have um, grown up in places where they've gone through much more and much worse, and it's not the most momentous thing in their life. But I've been lucky to grow up in this country and in a privileged position where nothing so momentous has happened to me, I do appreciate the ability to see it while it's happened, and see kind of history in the making, and leave it for current and future generations to understand what it all means and what we can learn from it.
That's a wonderful finale to our discussion, and I want to leave it at that because I think you said it very very well, and I hope we'll continue to have conversations about sort of what history is unfolding right now, and how as amateur historians, and for me, I kind of I think of myself as an ethnographer, as a documentarian, and someone who facilitates public access to media. How can we help creators and historians and anthropologists and folks capture and document some of that as it's happening? So this has been our contribution to that today. Thanks so much, Ken, for coming on the program today.
Thanks.
Be well.
You too.